Hi everyone, welcome back to my channel. We are back with episode number 3, and this is the incredible story of Dr. Suresh Singh Sihmar, who started his journey of becoming a doctor by studying agriculture, left that to become a dentist, thereafter started preparing for UPSC, and eventually did his MHA, that is Masters in Health Administration from TIS. He's currently working in the health insurance sector, and if you're someone who's even slightly interested in the health insurance business, well, this is the episode that you need to watch out. Sir Suresh sir gives out a lot of information about what the health insurance sector in India is like, what kind of job opportunities there are, what are the pros of this particular job, what are certain cons, what is the lifestyle like, what kind of work is it that you're going to do, and even if you're an intern and if you're looking for an internship after having done your BDS or after having done your post graduation, there's a lot of information that he gives out on the kind of internships that are available with the government as well as the private sector. So please do go ahead and check this video out, but I would highly recommend you sitting down with a pen and paper for this particular episode, because there's so much information that's coming in your way, you will not know what to do with it. Make sure you've listed out all the resources that he mentions. There are a lot many universities that he's telling us about, lot many courses, lot many job opportunities. So make sure you're sitting and writing them all down, and do go ahead and make use of them. If at all you have any doubts or any queries, please address them in the comment section below. I will have my email ID linked down. You can mail me and ask me if there are any doubts or queries that you have. Let's not waste any more time and jump right into the video. I'm sure you'll enjoy it. Welcome, sir. And like all of my videos, so we'll first start with your story, all about you, and then slowly we'll shift to what it is that you're doing. Because I feel like the field that you have carved your niche into, or you started with health insurance, very little is known about that. हम although एक छोटा सा part पढ़ते हैं हमारे curriculum में, मेरे ही department में, but we have very little that we actually know about what really goes on in health insurance, right? So do tell us a little bit about yourself. So a brief introduction about you.
Right. See, I come from Haryana, and my father was traveling length and breadth of our country into armed forces. So, like 10th, 11th, 12th, ऐसे ही अलग-अलग जगहों से हुई है करके. And so I was, I had taken both physics,
Maths
chemistry, bio, and maths also.
and bio,
But
both, yeah.
yeah, both was there. And due course of time, what happened, like I was scoring good in biology rather than in maths.
Right.
एंड आई वाज नॉट हैविंग एनी आइडिया कि उसके आगे क्या होता है, क्या उससे वो होते थे कि ये 5 सब्जेक्ट हैं, हर साल उनमें कुछ अच्छा परफॉर्म करना है, अच्छी परसेंटेज लानी है, बस दैट्स इट। वो उसके आगे पता नहीं था कुछ भी, ठीक है ना। बट लेकिन माय बायोलॉजी टीचर शी गेव मी द फॉर्म ऑफ पीएमटी, एंड देन इट ऑल स्टार्टेड, इट वाज अ जर्नी इन ऑल टुगेदर, कि अब इसको कैसे करना है, और मैम ने बोला है तो उसको करना है। तो
Okay.
वहां से स्टार्ट हुई थी। एंड देन आई स्टार्टेड टेकिंग कोचिंग फॉर प्री मेडिकल टेस्ट, and I took from Akash Chandigarh, then I moved to Akash Delhi also. But in between, my father took some guidance from some of his colleagues. They told that कि BSc honors agriculture भी अच्छा है करके, and then I joined BSc honors agriculture in Chaudhary Charan Singh Haryana Agriculture University Hisar also for some time there.
That's good. That's good.
Although it was like I don't know why I left that at that point in time. I was university topper in that college.
Oh, wow. Fantastic.
And when I left that in one semester only, my dean was, I was sitting with the dean, and he was saying कि, it is such a foolish thing you are doing. But in those times it was, like craze of, just medical engineering, right? And I knew that I'm not going to do engineering, but at least this is also not my cup of tea. Okay. Then somehow, I left that thing. Then again I prepared for pre-medical test. Then my father used to, always force me that, you have to appear for other options also. Then I used to appear for AI examination also, although I got some good rank in army institute of technology also that time. uh, but I was getting a mechanical engineering over there, which
Okay.
was almost like I felt like नहीं, मतलब machines वगैरह से तो मेरा नहीं है, मुझे नहीं उसमें spend करना है time जो है, ठीक है ना। बट एनी हाउ एमबीबीएस जो है वो दो तीन जगह पे मिल रहा था, तो उस टाइम पे प्राइवेट कॉलेजेस में मिल रहा था, जो
हाँ
कि अंबाला में था, मौलाना कॉलेज में, एंड देन वन वाज देयर इन बेंगलुरु, रमैया मेडिकल कॉलेज वाज देयर। बट आई थिंक दोज उस टाइम पे फीस वगैरह स्ट्रक्चर जो है, बिकॉज आवर फादर यूज्ड टू सर्व इन इंडियन आर्मी, तो हम लोग उतना अफोर्ड नहीं कर सकते थे करके, ठीक है ना। सो व्हाट आई डिसाइडेड कि एटलीस्ट व्हेन आई वाज दैट वाज अ डे व्हेन आई वाज अपियरिंग फॉर एम्स एग्जामिनेशन, एंड मैं सडनली बाहर आया एग्जाम देकर। एग्जाम मुझे उतना भी अच्छा नहीं हुआ था कि मैं सोचूं कि मेरा एम्स में हो जाए करके, लेकिन मैं बाहर निकला तो फादर वाज स्माइलिंग।
हाँ
मैंने कहा पता नहीं क्या हो गया करके जो है तो ही सेड कि यू गॉट सिलेक्टेड इनटू एसीडीएस। मैंने कहा अच्छी बात है। अब लेकिन मेरे अंदर में था वो फिर से कि एमबीबीएस तो नहीं है, बीडीएस है फिर से, राइट।
हाँ
बट एनी हाउ, अब मेरे उस वक्त पे ऑलमोस्ट 2 से 3 अटेम्प्ट जा चुके थे करके, एंड और ज्यादा टाइम स्पेंड नहीं कर सकते थे। एंड मुझे लगा कि चलो अभी कुछ और पेरेंट्स के साथ रिलेटिव्स वगैरह ने बोला तो वी शुड गो फॉर इट। हालांकि मैं वहां पे जब आर्मी कॉलेज ऑफ डेंटल साइंस में गया, इट वाज नॉट अ बैड एक्सपीरियंस, इट वाज गुड एक्सपीरियंस देयर आल्सो। बट व्हाट आई यूज्ड टू एंजॉय देयर वाज लाइक इंटरेक्टिंग विद द पेशेंट्स। बट सबसे ज्यादा मुझे क्लिनिक से ही ज्यादा जो है मुझे आउटरीच जो प्रोग्राम्स होते थे, लाइक देवर मोर इन लाइक कैंप्स होते थे हम लोग। आई थिंक डुंडिगल कुछ जगह थी, वहां पर हम लोग कैंप्स के लिए जाते थे अपने मोबाइल हेल्थ वैन के थ्रू। तो वो मुझे सबसे अच्छा लगता था। और पूरे डेंटिस्ट्री में मुझे जो मेरिट भी मिला था, वो पब्लिक हेल्थ डेंटिस्ट्री वाला सब्जेक्ट जो उस वक्त कम्युनिटी डेंटिस्ट्री होता था, वो
हाँ
उसी में मिला था मुझे। हालांकि उस वक्त जो इंटरव्यूअर थे, जो अपने एग्जामिनर आए थे एक्सटर्नल जो है, उन्होंने मुझे हेल्थ की डेफिनेशन पूछी और मैंने सीधा मुंह पे बोल दिया था कि भाई जो है मुझे ना वो रट्टे वाली डेफिनेशन नहीं आती।
तब हाँ
एंड लिटरली उन्होंने जब मुझे पूछा, तो मैंने ये बोला कि इसके सिर्फ 3 आयाम ही नहीं होते जो बोलते हैं ना, फिजिकल मेंटल एंड सोशल होते
राइट।
करके। मैंने तो बोला नहीं, 5 होते हैं, उसमें स्पिरिचुअल भी ऐड कर दिया और भी मैंने कुछ ऐड कर दिया था उस टाइम
पता
पे।
है ये है भी सर।
ओके राइट
ये
राइट,
है।
लेटर ऑन टू नो कि ये सब भी मैटर करते हैं,
हाँ
राइट।
हाँ these are।
सो बट लेकिन उन्होंने कैसे करके, लेकिन कि भाई जो डेफिनेशन वो नहीं सुनाई, लेकिन फिर भी जो है उन्होंने अच्छे मार्क्स दिए थे। और मेरे को एक ही से बड़े मेरिट मिलते, वो दैट वाज इन पब्लिक हेल्थ डेंटिस्ट्री और कम्युनिटी डेंटिस्ट्री दैट टाइम। एंड इंटर्नशिप के दौरान जो है ना, व्हाट आई यूज्ड टू ऑब्जर्व वन थिंग, दैट मेनी पेशेंट दे यूज्ड टू कम टू अस, दे वर फ्रॉम वेरी वीक बैकग्राउंड,
या
इकोनॉमिक बैकग्राउंड, राइट। एंड समटाइम इट यूज्ड टू हैपन कि 5 दिन का मेडिसिन कोर्स लिखने के बजाय, एंटीबायोटिक्स वगैरह लिखने के बजाय, हम लोग को 3 दिन का ही लिखना पड़ता था, और वो भी पैसे जो है समटाइम वी यूज्ड टू पे फ्रॉम आवर पॉकेट ओनली।
राइट।
And it happened several times, and it made me get into that thing, that there is a huge population which are not able to access the dentistry, and
या
it is not that affordable। और जो कि हमें लगता था कि जस्ट कितना है ये, तो मतलब बहुत कम में हम लोग कर रहे हैं, आर्मी कॉलेज में जो कर रहे थे उस वक्त जो है। तो जो अफोर्डेबिलिटी नहीं थी, एक्सेसिबिलिटी नहीं थी, और अवेलेबिलिटी भी नहीं थी सर्विसेज की उतनी ज्यादा उस टाइम पे। तो later on it came to me कि मुझे like you can say somehow I have to improve this healthcare system में मुझे कहीं ना कहीं कुछ करना चाहिए करके, right? So rather than getting into dentistry as a practice, I started preparing for UPSC examination in my final year,
अरे वाह।
sorry, internship, right. And I got this guidance through Dr. Ravjot ma'am, who is currently a senior IPS officer.
या
So उनके गाइडेंस में मैंने मतलब स्टार्ट किया प्रिपरेशन। देन आई केम टू दिल्ली। आई हैड सेवरल अटेम्प्ट्स, बट some or other stage I could not clear it. But anyhow, then I came to know about like other options,
राइट।
like which we can do into healthcare specifically, because अगर मेरे को एडमिनिस्ट्रेटिव सर्च में भी जाना था, तो मेरे को दो एरियाज बहुत क्लोज थे, देवर लाइक हेल्थ केयर एंड एजुकेशन। तो कहीं ना कहीं फिर मुझे, जब मैंने सर्च किया इन सब चीजों के बारे में, तो आई फाउंड लाइक इंडियन इंस्टीट्यूट ऑफ हेल्थ मैनेजमेंट एंड रिसर्च, IHMR, बिकॉज वहां पे अपने कुछ सीनियर्स जो हैं ऑलरेडी कोर्सेज कर चुके थे। देन आई कॉन्टैक्टेड देम, एंड तो उन्होंने उसके एग्जाम्स के बारे में बताया। फिर टेस्ट के बारे में मुझे उतना ज्यादा नहीं पता था, लेकिन अपॉन डूइंग सम लिटिल रिसर्च आई केम टू नो। Then I was appearing for other exams like MBA, CAT, MAT also. because I had a preparation of like UPSC, so I just try to attempt those examination also.
Right.
So how I landed up rather than into UPSC, I landed up into the health administration course in Tata Institute at Mumbai. Although that year I appeared like CMAT for the for MBA programs, then IHMR also, and Symbiosis, and I appeared, yeah, I appeared on all the three, and I got the ranks in all of them, and I got the letters for the counseling. But already Dr. Rakshita ma'am was doing a, course there at Tata Institute. So I connected with her, and then I came to know this is the best institute to do that MPH course from there, because it is like more like return on investment, as well as economical, as well as it has a good curriculum. So I just thought of joining Tata Institute. Although there also a lot of confusion was there which field to choose,
Yeah.
because there are four streams,
Okay.
like MPH is there in hospital administration,
Okay.
public health administration, social epidemiology, then health policy, finance and economics. So already ma'am was doing in health policy, but she told me that you can. She just asked me few questions, and then like I told her that it will be policies like very narrow to me, and I want something which is like more having more scope.
Okay.
So she like in social ophthalmology also, it was like very less scope
Uh,
was there, and hospital administration was just pertaining with the hospitals administration. So she told me that one thing is there, that you apply for health administration, and second thing is when the interview will take place, then the interviewer will also the teachers will also make you understand that which course is for you. So don't think much about that thing. After the interview you will be given a field which is more suitable for you,
yeah.
and that really happened.
Okay.
This is how I landed up into Tata Institute, and then after that from the campus placement I joined Manipal Cigna Health Insurance company, which was earlier known as Cigna TTK when I joined, and then the Manipal group took over it, and then it was like Manipal Cigna Health Insurance. Sorry, it is
So,
very I think I've got taken a lot
Naini,
of time.
I think you covered it so beautifully. You just told everything so very, I think in such a structured manner, your entire journey. It has become so clear to me क्योंकि when I am listening to you, I really understand the course that you took. And I think it's incredible, and I think it's so relatable. A lot of students will relate to it because I think UPSC, especially when you mentioned, sir, okay, go back to the beginning. See, the way you decided that you wanted to become a doctor. I think that's interesting. Then finally you got into ACDS.
उसको उस वक्त मैंने बताया ना कि मतलब बिल्कुल कोई आइडिया नहीं था उस टाइम
हाँ,
पे। वो
आपको मतलब
जस्ट एक
थोड़ा
स्पार्क,
आइडिया
हाँ एक
लगा।
स्पार्क में हमने दे दिया, हाँ एक स्पार्क में हमने दे दिया। देन होता ना कि टीचर ने जो बोल दिया उसको करना है, somehow
राइट।
you have to do that thing,
हाँ,
right? और वो वहां से जर्नी स्टार्ट हुई।
एग्जैक्टली। एंड मतलब ये अच्छा है कि डिविएट करते हुए भी फिर आप इधर आए और एसीडीएस में भी व्हाट आई लाइक्ड अबाउट दिस इज कि यू वर नॉट अंडर दैट पीयर प्रेशर कि सारे क्लिनिक्स में जा रहे हैं सो इवन आई हैव टू शिफ्ट ओवर देयर। आई लाइक्ड हाउ यू टॉक्ड अबाउट हाउ यू कनेक्टेड विद पब्लिक हेल्थ सो यू probably wanted to get into a health system wherein you can correct a lot many things because this is the same thing that happened with me. Even I could somehow connect more to public health, and public health sadly is very underrated in India, है ना? We don't know much
एग्जैक्टली।
about it in general also. Public health or public health dentistry, it's very underrated. I think it really people need to know about it more, read about it more. Also sadly because
राइट।
there's very less that we see. मतलब हम अंडर ग्रेजुएशन में बहुत बहुत कम चीजें देख पाते हैं। जैसे हम बाकी डिपार्टमेंट्स में कैविटी कट करते हैं, वी मेक डेंचर्स, वी गिव क्राउन्स, वी डोंट डू एनी ऑफ द research or survey procedures, or we don't write any protocol that we still
राइट।
do in
राइट।
PG, so which is why I feel there is a disconnect. Then I also like how you explored UPSC. And I feel like कोई भी पढ़ाई ना कभी वेस्ट नहीं जाती है. So you prepared there, but look, it did land you at a premier institute in the country. This is
And
का नाम
that
चलता
too
है.
all because of grace of God, in the first attempt only I could crack that
Yeah,
thing. Because of that, because I prepared for UPSC, because that
exactly. So
didn't do waste. Right,
yeah,
right.
that's fantastic. And I also liked how you mentioned, you kept on talking to people. So that's another thing I want to give out to students, that talk to your seniors, build a relationship. It's very important, isn't it? Like I know you,
Exactly.
and it was, and this is, I think, the one platform that even I'm utilizing. I'm connecting with my seniors or people that I know. and they are helping me back. And same will be the case with everybody. So when you build a relationship, people will get back to you. Everybody, I
Right.
feel everybody has good inside them and they want to help people, you know, you just have to ask. So that's
Right.
another
Right.
thing. And so you got into this. How was your experience there? So what was it like? Because BDS में हमारा
Uh,
entirely different चलता है. How was it over there? You have a semester system going on there. How was masters in
yes.
health administration? So did you go ahead with masters in health administration then?
Right. Right.
Yeah.
So what happened on the very first day when I saw Dr. Rakshita there, and I was full of anxiety कि interview में क्या होने वाला है वहां पे, ठीक है?
Um,
And professors were like, they were calling the professors like by name.
okay.
There were
Yeah,
no
that's
sir and madam there.
yeah.
Okay. And then suddenly, what is going to happen here? What kind of institute is this? Because in Army College of Dental Sciences, we used to have, sir, ma'am, and very, after second year itself, we used to,
It was very
say
strict.
like that. And here, people are PhDs, sometimes they are double PhD, they are, well-known scholar internationally, and still they prefer to be called by name,
Yeah.
right? So
It's a cultural shock in
anyhow, then
itself,
I,
isn't it?
yeah, it
Cultural
was
shock
really
like
a
that.
shock,
Yeah, exactly.
right? But that philosophy is actually very good because we more remember the people by when we call them by the name rather than we
Yeah,
call by them sir or ma'am, right?
that's true.
So what happened then? Interview was there, and suddenly, it was interview was like a roadies round there. It was totally
So,
like roadies.
oh,
Yes. And when it was like three board members were there in that interview. After the written examination, after clearing that all India examination, then we had a written test also based upon essay, and
okay,
we have to write an essay.
right.
And somehow I was in that period during my UPSC preparation, I attended one meeting which was like I was not an invited person over there, but somehow I could manage because I was studying for UPSC. So I attended a high level expert committee group meeting which was organized by Government of India, Ministry of Health and Family Welfare, and it was on universal health coverage.
Okay.
That day I bunked the UPSC class, and then I, because this was totally of my interest, because
Yeah,
okay, if I had to get into UPSC also, then my aim was to improve that healthcare
health.
system or education system, right?
Yeah,
So somehow this was very interesting for me. So then I attended that meeting, and there I came to know about what health is actually. It is a state subject, and how health can be, at the center level it has not much to make into policy level. More execution there is with the power with the states, and these all things, they help me in and then I came to know about various structures like PHC, CHCs, and up to district level hospitals, and research and referral institutes, and
right.
how these all systems are there at the state level. So this all helped me in writing the essay for the test. And then in interview, it happened like I told that I am so and so, and I come from Haryana. Although I told that my father served in Indian Army, so I had traveled across.
Yeah,
But then one lady professor was there. She pointed me that Haryana has a very low sex female sex ratio,
yeah,
and literally she was like to grilling me like anything on that point. Although she asked so many questions on that thing, but I had my own experience that in my one of my relatives, they asked me for general help in to get that sex determination done, because that's really it was hurting me that she's asking me so much question, but at the same time that was a reality
yeah,
in Haryana. So I just told her that if that happens, she raised that question that if that happens, what you will do. Then I
okay.
told her in a sense that it happened already, and what I have done, that I will tell the reality. But I told my relative that I will just call the number which will be putting them behind the bars if they are going to do that thing. I'm not generally going to help them, right?
Okay.
And that was the point where one point was there that she was highly impressed on that point. And other thing was like having the background from UPSC, she told me. And then we had that meeting with Dr. Abdul Kalam also in our college
Yeah,
days. So
yeah,
I
yeah.
told about how I have read his book, Wings
Wings
of
of
Fire,
fire.
student version, right? So I told that how he has written about very 10 most important fields of development sectors and how healthcare and education will be in future. So I just had a few interaction with that thing, and with that background, in the light of that, I'm just quoting Dr. Abdul Kalam in those senses, and I like to work upon these all areas. So somehow that was, interview experience, it was really pointing on those very
Pressing issues.
pinpoint areas, but at the same time those were realities. Then I later on I realized that, this is how. And then they came to know about me, that what background I have and which field I should be given. And then after the interview, I was, totally, after when I met Dr. Akshita, then she told me, now how do you feel? Then I told that, really I have put in what I am, and they will do the justice, which field I am made for.
Yeah.
And this is how, after those four fields, I was given health administration in that.
Yeah. And that was so well suited to you, isn't it?
Yes, yes, and really, because as per the scope of that, how much different field you can work upon if you are doing in health administration, and what are the different things you learn, and the kind of internship you go through. So I will just like to share, what kind of curriculum we have in TISS. That also will be useful, because it is quite broad. Like
Yeah.
Dr. Himangi also told in the interview that, we have in a first semester we generally have like general studies, like very foundational courses which are
Yeah.
there actually for UPSC people, those
Yeah.
who are get selecting for IAS, IPS and all. They also have foundational courses at their institution.
Yeah.
Same, we
So
are also trained in that
before
way.
you go ahead with that, because just to form a connection, I would just like to make a point here that for students to understand that why this interview was relatively easy for sir, because he was preparing for UPSC. So general studies in UPSC is a very intensive area. So you have to be very good
Right,
with GK and very good with the your general surroundings, I would rather say.
right,
So and
right,
this is sort of evaluating you at that level. So if you're
right,
not somebody who is well versed with your surrounding or reading newspapers or watching the news, I would highly suggest that you start doing this. In general, also, I feel like this is very important because as doctors now we are very we think it's not important for us, which is also the point that Himangi ma'am made. That a lot of times doctors don't tend to read upon all this. And now I feel like now I of course read the news and so does everybody else that I know. But it's important since the beginning because we're going to work in the
right,
health sector. It's very important that we are acquainted with how the system actually works. PHC,
right.
CHC, district level, ये शुरू से बताना चाहिए. Now please do go on, sir. You were telling us about semester one,
Really,
general
really,
studies.
actually, Ishita, this is very, very important point. And see, although we know that it is a very focused field. Medicine
Yeah,
is a very, very focused field, and we have to work upon live bodies. We are not dealing with machines,
yeah,
but at the same time, it is so vast in itself also, that it is not the fault of doctors that they don't study about other things. But at the same point, having said that, I think we should add up, these things parallelly, like
yeah,
some sense of history,
yeah.
geography, economy,
Civics. Yeah,
policy,
yeah,
how these all systems are there actually. Healthcare
exactly.
systems are there, right? Not only in the case of like when we do the specialization like community medicine or something like that, but
In
at the
general.
same at the, like at the bachelor's level also,
Yeah, yeah.
so that they are aware of that in what system or in what ocean they are going to enter after
Exactly,
these all,
exactly. Because
because it is
otherwise it will become very difficult. Just if somebody wants to prepare, otherwise it comes like, oh my God, now I have to read this. So that adds another layer of burden of subjects. But when you are just
exactly
casually also going through it, now then it's easy. Then it's not as difficult.
right. Right. And it is not, in a day or two or in a just
Yeah,
1 or 2 months only. You can't just build upon all these things.
exactly. It
It
has to
really
be.
takes time. It takes
Yeah.
time.
And
And generally, this makes a large component of the examination also at TISS and other national level examinations.
exactly,
Right.
exactly. So, first semester is all about general studies, right? MHA. Then what about
First
second
semester is
sem?
all. Second semester, you have more pertaining to management courses, like
Okay.
you have human resources management,
Right.
particularly in healthcare, right? And then healthcare systems are there, health policies of different countries, and
Okay.
health systems of various other countries,
Okay.
like UK, US, Singapore, Thailand. because,
True on that.
and then at the same time we used to study what are the various systems, advantages and disadvantages which are having there in the different states of India.
Right.
Because India is moreover like you can say entire Europe,
Yeah.
right? So one system doesn't fit here. We all have to take up some or other advantages of different systems to adapt here. Like
Yeah.
some states like Andhra Pradesh, Tamil Nadu, Kerala, they are they are at that stage of development that they can take up some advanced systems. But
Yeah.
some states like our northern states like Uttar Pradesh, Bihar, they can't match directly to that advanced level at this point in time. So they
Yeah.
have to match up with some systems, health systems which are developing in or they are in making, right? Right.
This is
So
such a
these kind
fantastic
of
point
things,
you're making. Yeah.
yeah. So such kind of things were there in the second semester. Then in the third semester, we are more like uh, I would say like more into healthcare. Again, healthcare programs were there, national level healthcare programs,
Yeah.
which are run like National Health Mission
Yeah.
and National Urban Health Mission,
Yeah.
National Rural Health Mission,
Right.
and various other programs like National Immunization Program and like Surakshit Matritva Yojana and all, vector-borne disease control program.
Right.
And not only that, we were theoretically studying these all things, we were, almost like that is one of the advantage with TISS is that, they give you exposure with the internships,
That's
like
good.
almost around 4 or 5 internships we did. Two
That's
were
good.
extra, but 3 were from the institution side. So like for the national health programs, we were associated with the Navi Mumbai Municipal Corporation,
Right.
and we used to go to their offices, and then we used to study how that urban health post works and how a rural health clinic works there, right? And what are the staff working over there, what is the human resources working there, how the pharmaceutical system works there, how the supply chain is working there, and how the national level program from the central government of India and how the state level programs they are implemented at that level, and what are the challenges, because really data management and all MISs and the shortage of staff, and generally what we used to feel the management is totally lacking, because the medical doctor has to do the management of those urban health posts,
Right.
right? Because that particular like for 10,000 population, that particular PHC or that urban health post is there, and only a doctor with a medical background, and somehow that medical background doctor is not doing medical work now, he is
Uh,
doing management work. He
right.
is not made not
To
supposed to
do
do
that.
that thing.
Yeah.
At
He's
the
not
same,
trained for
yeah,
it.
and at that same, yeah, he's not trained for that thing. So, and really the doctors they used to accept that thing, because when we used to interview those with the focus group discussion and other things based upon our research projects during those internships, so they used to tell really that we are not trained in that thing. We have to most of the time go for trainings, then we come back here, then we have to implement those things, and we are really missing on our clinical works,
Right.
right? So that was a really mismatch of our healthcare system, and really that has come up during the COVID period also. That
That's
how miserably Indian healthcare system, it was almost collapse
yeah.
during because of the lack of the public health management is really was lacking, because
Yes.
medical doctors are not supposed to do, or they're not trained enough
Managed.
to do the to the management work, right? And there is a lot of things like human resource management, supply chain, then pharmaceuticals and national health programs, and various other things are there which has to be managed at that level. So it's not just clinical work, right? Although
Uh,
some experience they gain through the working number of working years, so they are utilizing that thing. Although they agree on that thing that we lack on the management part, but at anyhow, because of that, that is one of the biggest challenge in our healthcare system, that human resources for management is still lacking in the public health.
I agree, sir. I agree. This
So
is
this
a
is how
huge problem.
this is how third year, third semester was there, and then fourth semester was like moreover like into international health systems, and yeah. So this is how broadly like basic of Indian society, foundation courses, then management courses, and then particular management applied to the healthcare. So this is how that course is designed. Yeah.
This is how it is very holistic. So they train you how to
Right.
take care of everything. Okay.
Right.
So
And
after
almost,
this,
you know, 50% of that, Ikshita, that is, 50% of the time we spend on the fields.
oh,
That is
that's
most important. That
yeah,
is most important. And particularly we have, traveled across tribal areas
okay,
and, very socio-economically backward areas in
right.
Maharashtra, and like in state of Bihar, where, totally the healthcare systems were like, if I share you the story, then it will be like totally horrible when we did the research there with Care India as an internship part.
Yeah.
So this is how, I would say that curriculum was designed in such a manner that we were not only theoretically trained, but at the same time we were exposed to the, in the fields, so that to understand, how the challenges are there at the field level with the healthcare systems.
Because this is so important, I'm happy that you mentioned this because a lot of time what people think is, or what students or the general outlook is that when you're in public health, you're sitting in a nice cozy AC office and you're only working on the laptop, which is not the case. You have to go out in the field, you have to work, which is also synonymous with what people think life in WHO is. WHO will put
Right.
you there once you've done your work on the ground. You have to have your foot on the ground,
It
dirty,
is
muddy, then you will get there.
right.
So it takes time,
Right.
isn't it?
Even after getting into WHO also, they still have field visits, because
Yeah,
they have to stay connect with the system, from the
absolutely.
tip to bottom. Tip to
Exactly.
bottom, they have
How
to
will you
connect with
scan
it.
it? So how do you scan what the healthcare of a place is like unless you go out there? Because you're a
Right.
doctor, you're trained like that, so you will be able to measure it, isn't it? A technician will
Right.
not do an equivalent क्या at par job भी नहीं करेगा. So you have to do it yourself, which is very important. So I'm so glad that you mentioned it and we covered it over here. So all right. So after this, I believe there were campus placements for you all, right?
Right. Yeah.
And then you got placed
So
to a health insurance company.
see, we had, campus placements were designed in two phases.
Okay.
One was for the corporate and second was for the public health,
Oh, okay.
like for the government institutions.
Okay.
Although what scene was there, that student who gets selected, they'll be out of the this thing selection process, right?
Yeah. Okay.
So, and it was like, we all have to get some placement, right?
Right.
So we keep on, appearing for the interviews when and we are getting any opportunity.
Yeah.
So luckily, what happened, that uh, like on the second day, or yeah, second day, this company came, and then on the first day I couldn't get selected for United Health Group, and some other Johnson and Johnson was also there. But anyhow, then I on the second day I made it to Manipal Signa. But I was like thinking of that getting into something for the public health, but now I'm getting into insurance.
Okay.
But that also, I was back on my mind. I was thinking that will it be doing justice to the field or something like that. But anyhow, only thing which came to my mind, that that insurance model is such a model that in that also a social component is already available there, right?
Absolutely. Yeah. Yeah.
Because a small premium when one contributes, and that add up to the pool, because everybody is not going to fall ill, but a small population which is going to get when they will not be well, so they'll be taken care of out of that pool. So it is having a social component, although it's a corporate, but it is having a social component also. Because I generally feel, whenever a person is healthy, like we all are healthy, like anybody is doing a rickshaw puller's work, or anybody is doing any kind of work, any role they are playing in the society, because that day we are consuming their services. But when they are not well, they are not able to do something because of their health issues, that day he or she is left alone,
Right.
right? He has to suffer on their
Alone.
own,
Yeah.
right? So that is somewhat, insurance provides that model, that no, we all are contributing. Out of that 100, if 5% are feeling ill, and that 100%, they are
Will
contributing
take
towards
care
that,
of them.
take care of that thing. So that was
It's
really motivating for me to
yeah.
join health
So,
insurance.
and good thought about health insurance. Good point that you made that this is how you decided that, okay, health insurance is a good place to be. Now, how was your experience over there? How did you feel? It must be very different from what we normally do as
Right.
doctors. It's more corporate, I'm assuming.
Yeah, I think this work culture is slightly very hectic, and mostly, the major challenge is that that health insurance companies, like the roles which we have for the doctors, actually they are at the headquarters level, right? And mostly these companies are based like in South India. They're not much in North India, like mostly in Mumbai, Pune,
Right.
Bangalore, or Hyderabad. So almost today we have 35 plus health insurance companies. I would say general insurance companies. Out of that thing, one component is health insurance, like because we can even doctors can even work for life insurance also.
Yeah.
But like health insurance, if we say per se, we have 35 plus companies, and even more companies are adding day by day also because of technological advantages which are coming, like fintech companies are also coming with the help of technology, how we can improve these all things in industry. So mostly these are there in the South Indian belt, and less of there is in the North Indian belt. So one is that challenge that mostly they are in the metro cities, and the cost of living is very high over there, and mostly
Yeah.
like working hours are also very hectic, although that is demanding because you can say that when I used to handle cashless services, anytime point in time any policy holder, if they are admitted into hospital and we have to adjudicate the claim, if any problem is there, he can't just stay back in the hospital. Because of that, we have not adjudicated the claim, we have not given the okay for that particular amount.
Yeah.
So we have to almost like 24 cross 7 availability was kind of thing which we were supposed to make, right? So that is something very uh, thing which is challenging. So somebody who wants to join into health insurance, so like mostly challenge will be like metro cities, they will have to stay back, cost of living, and working hours are quite hectic. But some sense of satisfaction was there that customers are like our larger family, and we are somehow uh, that thing, sometimes what happens, people are not getting treatment because of that high cost in the hospitals, and quality treatment is not given, right? So that somewhat we are in the process, we are in that role that we are able to help them out. Because of that, they have taken that policy, if they are now can spend 5 lakh or 10 lakh for that particular treatment, even
Yeah.
higher amount they can spend. But although they would not have come to a hospital or a corporate hospital if they don't have health insurance policy.
That's so true.
And
That's
this
so
is a major challenge, and particularly with the middle class of India, which is the
true. Yeah.
largest class in India, right?
Yeah.
Almost we have various layers of middle class, like uh, what you can lower middle class, and upper middle class. So almost like 60 to 80 crore of population still in India, they are having almost no cover, no health insurance cover.
Yeah.
Because
Because
if government health insurance scheme is there like Ayushman Bharat, that is still only for the below poverty line people.
does
And
not
still
cover us.
that
Yeah.
middle class, yeah, middle class is again missing over there. And those who are having very rich people, they are already having, so the middle class is the missing block there,
Yeah.
where still we have that sense of satisfaction that if these policy holders are there, they are getting quality treatment, and we are in the process of some role to play that there, right?
Yeah, that's so true. You bear the brunt, and but it's good now that you at least people are getting to know about this. And again, a very
Right.
nice point that you made. As it is going through a traumatic experiences when you reach a hospital, that in itself is such a big ordeal. Not being able to access help because you don't have money, it's again very, very, very sad. So I think
Very
insurance
sad.
is important, and that concept is also very important. Getting acclimatized to
Right.
the situation is very important. People should really
Right.
understand the importance of
And
it.
this was something, we when I was preparing for UPSC that day, all those times I used to study, like almost one third of our population, every year, many crore of our population, even, they get back into the below poverty line because of that health expenses.
Yeah,
Because if
very.
somebody in their family, they are suffering from like some chronic disease like diabetes or cancers, or any other neurological problem which has to take or kidney problems which has to take care a long course. So generally, and particularly when I was preparing for UPSC, those days I was teaching also to the kids of 10th, 11th, and 12th. So and I was teaching social science also to them. And there was few students of mine, those who had their parents were having cancers. So I could, feel that pain. They were very intelligent. They could have cracked IITs or some other medical examination or other good examination, but they couldn't afford coaching and other things because almost, 80% of their incomes, of their
Was in
family income,
treatment.
that was going into their expenses.
Yeah.
And there I felt, how that important is to have a health insurance, right?
Yes. Such a nice point that you made. So anybody who is still thinking about it, please go ahead and get yourself insured. It's really, really important. You just never know where what happens, where life will take you, right? So unless you're protected by this, you must
And
indulge
after
go
after
for it.
COVID, it is very, very important. At least, having a cover of at least minimum of 10 lakh cover is very, very
Very important.
essential.
Yeah,
Very
yeah,
essential.
that's very
And it
true.
is really painful for us as a doctor, when somebody is not able to get the treatment or a quality treatment per se, because of that, that affordability issue, right?
Very sad. That is true. That is true. So, sir, we are almost coming to the end of this amazing session. I really don't know how 40 minutes passed. Uh, feel like it
How
just
much
flew
time?
by.
How much time is there,
No, we
Ipsita? We are
have
left
time
with.
now. We have enough time right now.
Okay.
But I just
Can
want
I
to
share
ask,
a few? Yeah.
absolutely,
Yeah.
please go ahead.
You can ask. You can ask me if you have left with something.
I just want to know what is one thing that you like a lot about what you're doing, and what is one thing that you do not like much about what you're doing. It's
That I
that
told you,
simple.
that working
I think you've
working
covered it.
hours are hectic,
Yeah,
and one thing is that that affects the mental health, right?
yeah,
And which is really, really coming up with the corporates around the world. And because that is really, taking up this as a sandwich. This particular generation is getting sandwich because of that particular thing, that mental health is really coming up as a huge pandemic, like COVID has
but
come,
yeah,
which is very silent. Mental health is really very appearing to be very silent, but
that's
it
true.
is really impacting the current generation, right? So that is something is there. But although, governments in some part of the world, they have 4 days working, 5 days working, but on ground, these things are actually not reality in a country like ours, which is a developing countries. Because if you say no to, such kind of, policies, although on paper these things are there to, have 4 days working or 5 days working,
But
but on field, on ground, these
they
things
don't
are not
exist.
working in India
Yeah.
currently. Right, right. And few things I would like to say, that sense of satisfaction was that, you were in that role, somehow you are able to, make
Help
those
people.
people, getting the quality treatment. Yes.
Yeah.
So
So
that
one
was
thing which I
something
want to quickly
having.
cover is this course valid outside, or is it accepted outside? If somebody like finishes MHA in India, is it acceptable? Is it acceptable outside?
Yeah,
So can
I would say already Dr. Himangi ma'am has
she's
covered
covered it?
that
Yeah.
very, very beautifully. But in my personal opinion, what I would say, if somebody has to practice in particular country, they should be more aware of that country, right? So if somebody is planning to have a practice in United States of America or UK, then they should have that MPH program from that country only, because then they will know the ground situation over there, and then they will be able to implement, and they will be able to do innovation things and research on those subjects, right? Otherwise that will not be justice, right? Although these programs are valid, they are valid abroad, and but that doesn't make any sense. You still have to add on, because you have been trained in this particular curriculum, and you are going to apply in some other country. That doesn't I
Fit
think
well.
made a
Yeah, yeah.
justice.
So you have to go and learn.
Right,
And so any
right.
new opportunities for students
Right.
that you would like to tell us?
I would like to share that thing, that like I told you that we have various internship programs.
Yeah.
Like I did with the with the National Health Systems Resource Center, and they really offer you, and various kind of internship programs, like Niti Aayog is offering internship programs. National Health Authority, which is like working for Ayushman Bharat, they are offering internship programs. So these are something which we can do, and students from any background, they can do. It's not just like from dentistry, any other can also do, and that is very useful. And other thing is like various health programs of center level, state level, or at the NGO level. People should do the internship, because that makes you exposed to the ground level situations.
Yeah.
Like when I went to Bihar, because that program was not funded by Bihar government. That was funded by Bill and Melinda Gates Foundation. So even government of Bihar was not able to, know that what kind of health resources are there available in the ground. And in front of my eyes, I have seen that, after 60, 65 years of independence, in those times, or like 70 years of independence, we still didn't have any, community health centers in various areas, because almost like the population of Bihar is almost touching 12 crore. And
Right.
still we didn't have, almost in, because we did the research in almost all districts, 38 districts. And there were many districts where, these all levels which were there on paper, like PHC, CHCs, and subdivisional hospital, district hospital, they were not actually, they were on paper, but they were not on ground,
Wow.
right? So, and there was like, I saw that deliveries are happening in very miserable conditions. And then we came to know that why maternal mortality is so high, why infant mortality is so high. And I was even threatened to death also that time, that they don't उन्होंने बोला मुझे कि आप जानते नहीं हो हम किसके आदमी हैं करके. When I raised question on them, that why you are not saving, because lot of corruption is there. Even supply chain is going to have that materials and pharmaceuticals in those clinics in the PHC and CSC level, but that is somehow, embezzlement is done, or corruption is was lot on the ground level. And if you raise question, then you are threatened also. So that was how the experience were there when you go to the field. Like one experience I would like to share, when I was there for the tribal area of Maharashtra. They were working on the health insurance scheme there. And almost, that health insurance scheme which were being implemented at the village level, nobody was knowing that health insurance scheme. They were not even knowing which hospitals, which procedures are covered in this procedure, and how much amount they will get. And there was so much of corruption that if I get you in that hospital, then you have to pay me this much money.
That's true.
Although
That's
it was supposed to have health insurance for the coverage, but they were taking money out of that thing. So this is how at the ground level how the things are there. And really, that healthcare workers are actually not much trained. So but
yeah.
still, government of India is now training a lot. And I would just like to add upon, like, in coming times, in a decade or so, because it's not these changes are very like it takes long period.
Next time.
Public health cadre will come. Public health Dedicated public health cadre will come in India. Although few states are having, like in South India, like we have in Kerala, Tamil Nadu, and Andhra Pradesh, which they have not only doctors with the clinical experience, but at the same time, some doctors are taken from the clinical side, but at the same time, some doctors are taken from the MPH side also. It's a mixture. It's not just from the MPH, but from the clinical background also, they are taken after a certain number of years. And there is a dedicated public health
Got it.
cadre there. Right? So there is a lot of scope, those who are planning to have MPH in future. So public health cadre will come, and that is for sure. But at least, as the expenditure for healthcare, public health is slightly improving. In coming years, it will be reality. But although in some states it is coming, right? And few more things, like in health insurance also, uh, people from dental background also, at the base level also, they can at least enter into sales field. And they're not supposed to go into the fields. They can just enter by sitting back to their home, or while they are studying in dentistry also.
Okay.
Because because of the fintech companies, like Turtle Mint is there, Gromo app is there. There, any companies health insurance or life insurance or other any general insurance, people can sell. Even students, working women, non-working women, like housewives and all, they all can work upon, with the help of, at the ease of their work from home, they can work upon these, and they can enter into sales of health insurance, so that the penetration of health insurance improves in our country, right? And like I was working with the claims department. So there are other departments in health insurance where people can work, like underwriting of the policies. uh, and other is like provider network, like we have to enroll the various hospitals, empanelment is done. So there also doctors are required. And there is like pricing of the products, like health insurance. So actuarial also, they can, if the somebody is having a doctor background, medical background, plus data analytics also they know, then they
Okay.
can enter into actuarial field also. And generally, people can do some courses or some certificate courses from National Insurance Academy and Insurance Institute of India also. for that particular per se into the health insurance if they want to enter. Not only MPH, although MPH has broad scope, because they can enter into health insurance, they can go into hospitals, they can work into
Policy.
government, they can, yeah, it is more holistic, right?
Yeah.
But if per se if they want to get into health insurance, so there is two institute I would like to say. Insurance Institute of India, which is there in Pune, and one more is there, National Insurance Academy. So they are specialized for the
Health
insurance sector,
insurance.
right? Right. And anyhow, I think I've taken a lot of time. But
No,
yeah,
no.
one more thing I would like to add, that dental insurance is also somehow available in few policies. Like, people those who are working in corporates, they are covered for their dental insurance,
Yeah.
right? And many of the people, they don't know about this thing, that they are covered and they're not taking dental, treatments, right? And other thing is like dental, some new startups have also have come up, like my dental plan and dial dent and many other are working, which are coming up with the innovative ideas of dental plans, how the dental treatment also is covered, right? And I see, like, like initially when we were talking, like the doctors are very, they're in their own field, right? Medical field. And many engineers, they do the innovation and they do the startups, right? But
Yeah.
I think maybe like those people who might listen our talk, and many we do agree on this thing, that our coming generation, they are more innovative than us at the same time. So might be, dentistry will take a change in, from the clinical fixed brick and mortar model to a more mobile model, because
Yeah.
this is how, that public health, it has to reach to the public.
Right.
Like when I met in one of the meetings with the Dr. Amrita Sen,
Yes.
uh, in during my college days, PG college days, like when I read his book, it is not that patient has to come to the doctor, it
You
is
have
the
to reach.
reverse, actually the real
Yeah.
development is,
Yeah.
right? So how, and this is all will be depending upon the coming dentists and public health workers. They will be working how this system can work from this brick and mortar model, which is fixed, when where patient has to come, where how now that these doctors will be reaching towards the public in the
Right.
fields. That is more like, with the help of technology, and which is also mentioned in Dr. Abdul Kalam's book Wings of Fire, how telemedicine will take place. And similarly, teledentistry is also advancing nowadays,
Yeah.
and like portable dental chairs and other things. Now some institutes, they are starting up, like for
Yes.
example, I would say, like Seva Mob is working in Uttar Pradesh, Lucknow, and he is actually an engineer, but he has started with these all. And I had a very good conversation with him regarding that thing, that how he came to about this thing. But really, these things are innovations are coming with the help of technology, that how we can aim, or our fraternity and our other seniors and juniors, they can come up with in future, that how this model from that patient coming to the dentist, rather than how these services can reach to the
Patience.
doorstep of the patient.
Yeah. Yeah.
That can happen in reality in future by the help of teledentistry, portable dental chairs, and other things, right? So that is somewhat, and other thing is, of course, that which is close to my heart, that is health insurance, how it reaches to the masses. Because really, these three key words, like affordability, availability, and accessibility, is very, very key important thing when it comes to the health. Because we all consume the services of any healthy person, but when he is not healthy, we all left him alone.
That
That should
is
not
so.
be the case, right?
That should not be the case. Yeah. That is true. That is true. That is so true. So major key, takeaways from this particular session. I think people should sit with a pen and paper because you've given out so many points and so many important resources. So I think everyone should. I'll mention this in my introduction that you all should sit with a pen and paper and note down things. Thank you, sir. I think you made such excellent points, right from health systems to how a developing country should, the kind of health system we should have in our country. And it has a lot to do with us. When we understand all of this, that's also when we can put it in practice. Unless I understand, how will I practice? Right. So I think
Right.
but the message for students has to be that, start thinking, start feeling how how you would go about things, and also start reading. Reading, I feel, has so much to do with everything, and not just curriculum textbooks, others also. You draw and you never know where you will take inspiration from, right? And there are certain lines when you go through them, they're always going to stay with you. And an excellent point that you made was you read Dr. Kalam's book and look where you quoted it in an interview at TIS, and it truly helped you because for the person who must have been interviewing you, it would have come out as such an excellent answer. Somebody who's quoting books has a different level altogether. So I feel like reading
Right.
is very underrated, but it has really got people have got to start doing it at some point.
Really, I mean, these two people like Dr. Abdul Kalam and then meeting Dr. Amrita
Yeah,
Sen during my PG days, it was really, very inspiring. And this how, it all motivated that how we can, penetrate the insurance to the masses.
yeah,
One thing, that thing. And other thing is how this model of, patient coming to the doctor rather than, doctors going to the patients.
yeah, yeah.
This is the actual model of healthcare that will, but at least, some decades it will take, but really the things are
It
coming
will
up.
happen. Yeah,
Things
yeah,
have started coming up
yeah.
with the help of technology.
So the future is bright, not gloomy. There will be a public health
Right.
cadre, so people have got to pull up their
Yes,
socks.
yes, public
Yeah,
health cadre is surely going to come at least in near future. Like if this is 2022, by 2030, in many number of states, not on all, but at least many states will have public health cadre for sure.
yeah,
It's not like I'm saying anything because they are in the process
yeah,
and they can follow that document of universal health coverage from the Minister of
yeah.
Health and Family Welfare. But that is really going to
It is,
happen,
it is
right?
there. I think I read something about it last year myself. So I was talking to somebody in my own. I was so happy. Public health card is coming up. Maybe they'll have something for public health dentistry separately because you feel happy. Our country, health is everything, isn't it? That's where we start. That's where United Nations, WHO, everyone talks about that, isn't it? So when you cover health
Right,
is when you are fit is when you build upon things. So health is primary.
right,
It has to be there, and public health is
right,
that platform that's going to build it up, isn't it? So thank
right.
you so much, sir. Thank you so much for joining and for giving out so much of knowledge. I'm sure I'll have some questions and I will reach out to you for those. And
Sure.
yeah, such an enriching session. Thank you so much for joining and giving out so many good points. And good luck to you for
Really,
all your future endeavors.
I would like to thank you for giving me this opportunity and your times. And I really wish, best wishes for you for this kind of endeavors.